Gentlelady yields back. Now recognize the gentleman from California, Mr. Obernolte, for his 5 minutes of questioning.
So we're having a discussion today about why health insurance costs so much and how we can better allocate ratepayer dollars to healthcare costs. Mr. Markovich, I was pretty astonished last year when I heard that Blue Shield had contributed $500,000 to a committee supporting the passage of Prop 50 in California. Prop 50, as everyone in this room knows, was an effort to shift 5 congressional seats from Republican control to Democrat control. It's a pretty transparent, partisan undertaking that passed. Reasonable minds can disagree whether or not that's something that should have been supported. I myself feel like mid-cycle redistricting erodes voters' trust in our elections and our democracy. I oppose doing it in Texas. I oppose doing it in California. Reasonable minds can have a discussion about that, but I was just astonished that a health insurance company would wade into a political debate in such an enormous way. Why on earth did you do that?
Well, respectfully, Congressman, we didn't do that. What we have a long history of at Blue Shield of California is contributing to candidates from both parties at the federal and state level, including Governor Schwarzenegger, Brown, and Newsom. And we try to support candidates that we think will be thoughtful about healthcare policy. And this contribution to a fund that did not have a specified purpose is something we committed to as a part of that. After that contribution had happened, the governor then purposed those funds for Proposition 50, and our plan did not take a position on it.
Okay, to be clear though, these were 2 different checks for $250,000 each to a ballot measure committee, not a candidate. I mean, we understand supporting candidates, but this was to support a ballot measure. So if not Prop 50, what ballot measure did you think you were supporting?
Well, we didn't know, neither we nor the other healthcare companies.
You wrote a $500,000 check not knowing what ballot measure you were supporting?
We and other companies, including other healthcare companies, all contributed to this account, and it's not uncommon, particularly in California with lots of propositions, where candidates would prefer contributions to these types of accounts as opposed to direct contributions to their campaign support.
Well, now knowing what you know, do you regret having made that contribution? Knowing that, I mean, this was the only, Prop 50 was the only proposition that this committee supported.
Well, we did not support or oppose Proposition 50. We didn't take a position on that. So, it's a decision we consciously made going in, as did others, and just didn't have control over where it went afterwards.
All right, well, you in your testimony said that you think that our healthcare system needs some tough love. Respectfully, I'd like to offer you some. When a health insurance company wades into such an obviously political topic like that, it not only erodes your ability to work with folks on the other side of an issue, but also erodes consumers' trust in the system as a whole. So please don't do that again. Mr. Helmsley, I represent a very rural section of California, and one of the biggest problems we have is access to health care. So we are grateful to have critical access hospitals that are in most of the communities that I represent, but we're having an increasing problem with Medicare Advantage plans like the ones that you provide, where the critical access hospitals are no longer recognized as being in-network, and my constituents are forced to drive long distances to get the health care they need. And now I understand that keeping costs down is something that is often in tension with contracting with these hospitals, but let me also suggest that when people have to drive hours and hours to get access to basic health care, some of them just won't do it. And that denial of health care turns out to have much larger costs in the long term for our entire system. What can we do to improve that, and why are those decisions being made? Microphone, please.
Thank you for the question, Congressman. There's meaningful pressure in the Medicare Advantage space, given the funding actions taken in previous administration. It has put a great deal of pressure in terms of what can be served. We are very interested and dedicated to the rural health care and adequacy there. I will look into the situation that you describe. But we are also advancing initiatives to see if we can get rural care resources paid more effectively and more currently. So we have 4 pilots in the market that are expediting payment and trying to cut the payment time frames in half. And
Right, so
those are
I'm sorry,
successful.
we're out of time here,
broadly.
but these critical access hospitals are going to close if this trend is continued. That's not good for you, and it's not good for the constituents that rely on them.
We appreciate that.
Gentleman yields back.